Good morning, everyone. Welcome to Wellness Wednesday. Today we have Tim. Uh, Tell me if I don't pronounce your name right. DiFulco.
That's
You-
fine.
Okay. And he is with Rehab to Perform. And I'm going to turn it right over to you to introduce your topic. And let's just do that. Right over to you, Tim.
Thanks. Yeah, as Margie had said, director of physical therapy at our Bethesda location, and we've got locations in Germantown and Frederick and Columbia, Mount Airy, and Annapolis. So if you're ever in any one of those areas, feel free to drop in. For today, I told Margie I was going to speak on, when it's most important or relevant to see a physical therapist, which I know a lot of our patients struggle with, and gradual adaptations and training. Which is really just the speed at which it's usually comfortable to ramp up as far as an activity is concerned. So the first thing that I wanted to go over was as far as the speed that's considered safe to ramp up. There's a couple different numbers or things that you'll see out there, and with the most recent research, what's commonly accepted is an increase of anywhere from 10 to 30% in an activity over the span of 2 weeks. So in regards to running, you have to start with a foundation or a base, and everyone's foundation or base is a little bit different. So a reasonable idea would be, hey, if I haven't been running in this example for the last month, but I want it to begin, I pick a distance that I know I could run and feel comfortable with. For me, say it's 2 miles. I could run 2 miles one day, alternate the days that I run it, and I'll finish the first week having completed somewhere between 6 and 8 miles. If that's well tolerated, if I'm feeling fine, I'm no worse to wear, I'd probably want to consider doing that for an additional week, maybe two. So you have 2 to 3 weeks of what we'd call your base or your foundation. And then at that point in time, you can take that 10 to 30 miles that you've run, and you can steadily increase that over time. The reason why I use running as an example is because it's most often the one that we see people for, where they've really gone beyond their means as far as what they can tolerate. Some of the common complaints or surprises, I guess, that patients are shocked at is, one day they'll run 4 miles and say everything was great, and the next day they went and ran 6 miles and they felt terrible. But then we just had to kind of put it in the perspective that that's a 50% increase in their mileage day over day when they really don't have the foundation or the base restored to go do that. Obviously, you won't hear many of these complaints from anyone under 20. And as I'm sure everyone can appreciate, the under 20 crowd gets away with a lot more than the under 30 crowd and the under 40 crowd, and so on and so forth. So age, as well as your nutrition and your sleep habits and your general training volume, are all things that will influence what your initial tolerance to something like a running activity would be. This example can really apply to anything. If you're a yoga practitioner or you prefer strength training or Zumba classes, you just have to get in at some point or some level that you're going to tolerate well. And we usually let people know to just, underestimate it, make sure you feel 100% fine. You can always do more. And then once you've established that baseline, anywhere from 10 to 30% increases in a week is usually what's acceptable, or what we recognize as people will really be able to move forward without risk of aggravation or maybe possible injury. Which leads into our next point, which is often when it's appropriate to come to physical therapy. So I get a lot of questions from people. I think I don't know if they're hesitant to come or they feel like they want to downplay their relative injuries or aches and pains, but we always laugh in the end because that's what we're here for. Typically, if you have an issue that's bothering you and it's come up seemingly without any sort of precipitating event or incident, usually just recommend in the immediate 24 to 36 hours of relative rest. It's not just sitting doing absolutely nothing. That's really going through the majority of your routine in the day. Maybe just taking a temporary pause on the activity that you feel possibly aggravated it, or anything that you would deem as really high stress. And after that short 24 to 36 hour rest period, resuming that activity, if need be, at maybe 75% intensity of what you normally do, and seeing how it's tolerated. And if it's well tolerated, then you can keep on going back to it and get involved again. But if for some reason on a repetitive cycle, that activity is continually bothersome and short bouts of rest with gradual reintroduction to the activity is not doing the trick, that's one of the most common times where we would recommend people to come in and see physical therapy. you'll get your complaints or you'll hear your reports of people who just give up an activity or stop doing something or avoid something for a matter of weeks, weeks to months sometimes. And that's one thing that we really like to caution against. Um, in layman's thought process, it makes sense. If I just avoid something for a long time, then my body will become, not sensitized to it, and I can just hop right back in where I left off. But just as we prepare ourselves in all our various fields, it takes time and effort to build up a tolerance to something, an endurance for something, an ability for something. So if you take extended rest beyond that 24 to 36 hours, your system is actually gradually decreasing in its ability to tolerate the stressors of whether it be running or a specific sport or weightlifting. So that's why we typically caution against just these long, widespread time off from an activity that you may enjoy or really love, and just taking short rest, getting back to it. And then if it's an issue, then go and see your closest physical therapist and have them converse. We always tell people, worst case scenario, they come in, it's a relative minor, I wouldn't say non-issue, but a relative minor issue. And that's great. See you for one visit, maybe see you 2 weeks later on a follow-up with the initial plan that we gave you. Just see how's it going. Did it go out exactly as we planned? Or are you back to your activity? And then that's just 2 appointments over the span of a month where you didn't have to take any additional time off from your activity. You got the mental reassurance and confidence that you needed to go resume that activity. And you don't hopefully end up with some sort of chronic or long-standing lingering injury. At this moment, feel free to open up to any questions. I think that was just a good general overstatement on specific activities when it's appropriate to maybe get an injury checked out, and a good way to kind of safely ramp back up to or begin a new activity if you've been considering it.
I just want, because I know that, people with chronic conditions sort of live in a different world of in and out of physical therapy. And some of it is because they don't have boundaries like this, or they don't know those boundaries. But could you go over maybe somebody who, let's say, has MS or a condition like Parkinson's, because sometimes their condition leads to, I wouldn't say the injury, but the chronic overuse of certain joints and things like that, and they end up in the PT. But could you just go over like a set for people like that, because I'm going to refer to this recording, on what they would be. And then the other question is like, how would somebody calculate 10 to 30% of a yoga practice?
Sure. Yeah. So to your first point, I think things that we're typically most working with as far as neurological related type issues like MS, our strategies to help them. And this obviously depends on what their end goal is and what their complete level of function is. But the most immediate thing for what their foundation is they have to make it through the day. And depending on the intensity of their MS, daily tasks can be what completely drains them or aggravates their musculoskeletal injury and whatnot. So oftentimes what we're working with them on are tasks, strategies, and daily task maintenance and performance to be energy efficient. We make the example that all of us have the availability at the end of the night, ideally, to sleep, and our battery essentially restores and recharges to 100%. And throughout the day, it kind of decreases at a gradual rate that we can expect. And that's just not the case with people who are struggling with MS. So that unpredictability of just how much an activity can be draining for them requires to have a level of predictability in their training. So that's what we'll typically work on most with them. And these can be things such as, transfers, lifting techniques, carrying techniques, and then just general education and daily schedule maintenance on how to break things up so that they can ideally make it to the end of the day without overstressing a specific joint, specific muscle group, or just generally running themselves to a point of fatigue where they're then at least they're there exposed and at an increased risk of injury at that point in time, as we all are. When we reach our highest level of fatigue is when we're most likely to experience an injury. And then as far as yoga practice is concerned, time is usually one of the easiest ones. And this is, I know, a crazy concept that I struggle to follow with, but when I'm resuming something, you can always, duck out of class maybe 10 minutes early. Or if that's an odd one for you, can come in 10 minutes late, but making sure that ideally you've adequately warmed up beforehand. And then, of course, as with most practices, and especially yoga, they do a wonderful job of delineating classes on a relatively beginner, intermediate, advanced course. So for you, if you're practicing in an advanced session 3 times a week for an hour, a relative 10 to 30%, I would say, reduction from your full level. So to come in at a reduced level could be just doing 3 1-hour classes at a more intermediate level. It's tough to calculate for sure the exactness of that, but when you look at it and you put it out on paper, you can say, okay, yeah, what I'll be doing the next week is substantially less stressful or demanding on the body than what I normally do. And then you just see how your body responds to that. And if you're feeling really great, depending on your level of confidence, you could repeat that for an additional week. Or if you're really feeling comfortable, then in that next week, maybe then you can take that jump into either all 3 advanced courses, or you can slowly but surely reintroduce an advanced course. So 1 day advanced course, 2 intermediate, 2 days advanced course, 1 intermediate, and so on.
I like what you were talking about prevention wise, that you can go and see you and get a plan and then maybe one follow up. So it doesn't have to be like an every week thing because some people also look at the cost, and their insurance might not cover it and they're in pain, but they can't afford to go every week. Um, but
Yeah, I would agree. We're very cost transparent, which unfortunately not all of the profession is at that point yet. But we really pride ourselves on being so. I think our average visit is less than once a week for the majority of our patients, with our post-op patients being twice a week. Although in a traditional PT sense, some people would request that they're in 3 or 4 times in a week, which we feel is a little bit too much because frankly, things won't change between today and tomorrow. And if we give you the right things to be working on, everyone's at a level of independence where they can continue their progress at home. So we're of that same camp. I'm typically seeing people once, maybe twice at most in the week, but really the goal is as you get better, we reduce frequency as you move on in your recovery process. So I might start seeing somebody twice per week for 2 weeks, and then once a week for maybe 3, and then we go every other week for the remaining month or 2 to a point that they've achieved where they need to be, or where they feel from a confidence standpoint that they are prepared to do whatever the activity lends itself to.
I'm just looking at the chat. Linda, do you want to say anything or Sharon? Anybody?
Thank you for the tips. I just said, it's hard to modify, or like you said, come in late or leave early, but we know we have to work within our tolerance and nobody knows that better than ourselves. So it's a little hard to admit as you get older that you can't do all those things that that you see others doing and that you think that you have done in the past, but we'll get back there, just a different path.
Yeah, absolutely. I'm guilty of it too. And I always take caution to say can't do at the moment, right? Can't do yet. Because as with the case is, most people, unless you have like a really substantial injury history, can get back to whatever it is that you choose to do so. It just might be in a more gradual sense or over a longer time than any one of us would have done at 20 years old. It's very hard to see that sight. You see the end goal and you just want to be there immediately. So look, the only thing that's changed with you being older is it might take an additional 2 weeks.
Thank you.
Well, these were great tips. I want to thank you so much. I'm going to turn it over to Sharon to close out the session, who's our sponsor for the series. And while I have you, I'm just going to say next week, the 24th, is from Pain Arthritis Relief Center. Dr. Andrew Rill is going to talk about how to handle holiday stress. So that's a good one for all of us too. So Dr. Tim, thank you so much. I appreciate it. Sharon, over to you to close us out.
Thank everybody for showing up today, and hopefully, that's always a huge sort of challenge, is to know what and when and how to, I guess, progress up or even reduce when things start to get a little cranky. Is how do you go and address it before it becomes a monumental. And I love, Tim, that you talked about that, because it's so important, especially with people with chronic conditions, because they tend to have an issue and then they work back up. But then every time they have that issue that they're not doing maintenance or have a plan, then that next sort of I want to say flare up or incident just sets them back and back and back. So it is so important. So thank you so much. And hopefully we'll all be better at dosing our exercise and activity.
Okay, thank you all. Have a great day. Have a great rest of the week, and we'll see you next Wednesday.
Thank you. Have a great week.